Imagine you wake up tomorrow and half of the world is missing. Not black, not blurry, just gone. You try to pour coffee, and somehow the mug keeps landing in the wrong spot. You think your eyes are broken, but the real issue might be your brain. Today we're talking about hemianopia, which is a loss of half of your visual field, meaning half of what you can see. A common form is homonymous hemianopia, where the same side of vision is missing in both eyes, like the left half of the world or the right half. This can happen even when the eyes themselves look normal, because the problem is often behind the eyes and the visual pathways of the brain. Hemianopia often shows up as bumping into door frames, missing food on one side of the plate, or feeling clumsy in familiar spaces. Some people only notice it when reading, because the next words seem to disappear or they keep losing their place on the line. Driving can become dangerous, since hazards can appear from the missing side and you may not notice them fast enough. A tricky part is that some people are not fully aware of the missing area at first, so they may insist their vision is fine while daily tasks say otherwise. The biggest cause of homonymous hemianopia in adults is stroke, especially strokes affecting the back parts of the brain that handle vision. Other causes include head trauma and brain tumors, which can also damage the visual pathways after the eyes. After a stroke, visual field loss is common, and it can occur along with other vision problems that make recovery and daily life harder. Because the cause can be serious, the most important question is not just what you cannot see, but why it happened and when it started. Diagnosis usually starts with your story, especially whether the change was sudden or gradual, and whether you have other neurologic symptoms. An eye clinic can measure the visual field with a formal visual field test, which maps exactly what areas you can and cannot see. If the pattern matches a brain pathway problem, clinicians often use brain imaging such as MRI or CT to look for stroke, bleeding, tumors, or other causes. This is also why hemianopia often involves both eye care and neurology care, since the eyes may be healthy while the brain needs urgent attention. Treatment has two goals: treat the underlying cause and help you function safely with the vision you have right now. If the cause is stroke, treating stroke is the priority, and vision recovery can vary, with some people improving while others have lasting loss. Rehabilitation often focuses on compensation, meaning training your brain and eye movements to scan into the missing side more effectively. Some people use special prism glasses designed to shift or expand awareness toward the blind side, and others use visual search training to improve navigation and reading. Research reviews describe different approaches, including restitution, compensation, and substitution, and not every method works for every person, so a tailored plan matters. In real life, occupational therapy style training, home safety changes, and careful guidance about driving can make a bigger difference than people expect. If you found this video helpful, don't forget to like the video, subscribe, and share it with someone who might find it useful too.